Welcome veterinary professionals to today's video lesson. Today we're going to learn how the use of narrative can make you a more effective veterinarian in the exam room. The use of narrative is very important in veterinary medicine, seeing that our patients cannot speak to us and tell us what's going on. Therefore, we need to take the clues that both the animal and the owner provides to us to use together to form a plausible story to what's going on with each of our patients. Another method that can be used in veterinary medicine is the use of journaling or charting. You can use journaling both from an owner's perspective, writing down how their dog or cat is acting each day, and from your own perspective, your medical history, where you can look back through and see what has happened in various stages of this animal's life. The use of storytelling is one of the oldest and most natural methods of sense-making that people have had. The ancient Egyptians, for example, used it to explain the weather, the earth, the environment, why things happened and for what reason. For example, the Egyptians believed that the Nile River flooded due to the goddess Isis crying over the loss of her dead husband Osiris. We know that's not true, but it's a method that's been used for thousands of years to be able to make sense when we don't have complete information. With the use of narrative learning, we are more interested in helping our patients make sense of their pet's medical condition. They do not need the scientific or deep knowledge of what's going on inside their animal's body to have an understanding and make sense of what is going on so that they can help their animals. In the following example, we'll be taking a patient through a somewhat complicated case and what's going on in their animal's life. Through the use of storytelling and journaling between the owner, what he's telling us, and our own medical record, we'll use that to come up with a plausible story of what exactly is happening in this animal's life. Okay, Mr. Walker, what seems to be wrong with Kelly today?
She's been having some diarrhea. It's mostly soft. Sometimes it's very loose diarrhea. It's been going on for 3 or 4 months.
How's she doing otherwise? Is she eating and drinking okay?
She is drinking a little bit more water.
Okay. Eating fine?
Yeah, she's eating okay.
Has there been any change in her diets or anything like that?
No change in her diet at all.
Okay. What are you feeding her?
I'm feeding her Iams.
Does she get into anything that she shouldn't?
Sometimes she gets into things. Sometimes we go hiking a lot. She'll drink water.
Okay. Any changes in your home environment? Anything stressful going on? Have you moved recently?
We had a baby.
Okay. And has that caused like a change in her daily routine?
She's getting a lot less attention.
Okay. And how is she doing otherwise? Like how's her behavior, her attitude, her energy level?
Good. She's maybe a little bit more tired.
Okay. All right, let's take a look at her today. Hi, Kelly. How are you? You good? Can I take a look at you here? Can I take a look at you? Kelly. Yes. Can I take your teeth? Okay. No, this isn't why you're here today, but she's starting to get a little bit of tartar buildup on her teeth. Might want to do some at-home dental care or something.
Can brush your teeth, dog.
Yep. Her eyes look good. Her ears look good. Don't feel anything on her lymph nodes. No saying lumps or bumps or anything on her?
She does have a little lump right back here.
Okay. Yeah, that's probably just a little cyst or something, but we'll take a look at it here later on. Let me feel her tummy.
I'd like if I could just get some pills for this.
Okay.
I don't really want to do anything.
Well, she feels pretty gassy through her stomach here. Let's finish up and we'll kind of talk about her options. Listen to you. Alrighty, she has a pretty nice steady heart rate there. As far as what's going on with Kelly, alright, let me just make some notes on the exam here. She looks pretty good overall. Nice steady heart rate. She did feel gassy like I mentioned and stuff, so I think it might be just something like a gastroenteritis, some sort of stomach bug that might be causing it. So what we'd like to do is a fecal exam to see if she has any bugs, any sort of like Giardia that might be causing this diarrhea on her.
I can't afford any tests.
Okay. Well, what we can do then is let me get you a medication of what I think it probably is. And I'll have you give it to her. It's an antibiotic. You'll give it to her twice a day for a week. And if she's not doing better in a couple weeks here, I want to see you back in. Okay? All right. Thank you. Okay, Caleb, so you're back here with Kelly. We had her on the antibiotics for a week, and you said that the diarrhea got a little bit better.
It was maybe a little bit better, but still having diarrhea.
I was just kind of going through her chart here and just kind of looking at her past history. And it seems like she's been a pretty healthy dog, and that she's kind of had these bouts of diarrhea before. We've put her on the same medication, and it's gotten better. So I am a little concerned as I'm looking through here and just kind of the story that's telling that she's, a healthy dog overall. If she has diarrhea, we give this medication that makes it better. And here this time we did the same thing, and it's not making it all 100% better. So I am a little concerned that there might be something else going on with her.
Okay.
So what I'd like to recommend today is that we take do a blood test on her, where we draw some blood, we send it off to the laboratory, and they let us know how her liver, kidneys, all of her internal organs are doing, and maybe we can kind of find out if there's something more serious going on with her.
We didn't do anything last time, so let's do some tests today and see what happens.
Okay, let me borrow her for a moment, and we'll get that taken care of. Hi Caleb, it's Dr. Dewing from the vet clinic. How are you? Good. Well, I got Kelly's test results back here, and it looks pretty good overall. Looks like her liver and kidneys are doing good, her heart's functioning well, but there are some concerns on it. I was just going through a chart here and kind of just getting her history and kind of seeing what story it told me about how she's doing. And as I look back, I see that she's had this diarrhea before. We've treated with the same antibiotic that we've used before, and it's gotten better. What's different this time is it's not getting any better. So, I think this story is telling us that there's something additional going on, like I said, in the exam room. And then I have this blood work here that kind of confirms that. I could see that she has some issues with her electrolyte levels. And what that sounds like to me is that she might have a disease called Addison's disease. So I'd like to get you in here. We can do one more test that will give us a definitive answer of what's going on. And so instead of just having to, make up these stories and try to kind of figure out what's going on with her, we can get a more definitive answer if we do this last test. Okay, sounds good. Thank you very much. Bye. Okay, so as we discussed on the phone, we'll do the ACTH stim test. What will happen is I'll give her an injection, ACTH. We already took her blood beforehand, so 1 hour after we give this injection, we'll take another blood sample again, and then we'll compare those results.
Okay. Good girl.
Good girl, Kelly. Okay, we'll just let her hang out here in the clinic for an hour, and we'll get that second blood sample.
Okay.
All right, thanks. All right, Caleb, so we got Kelly's test results back, and it does show, as I suspected, that she has Addison's disease. So fortunately we can treat it with a course of corticosteroids. It will be something that she'll need to be on, but hopefully all these things that you're seeing, the dark skin, the diarrhea and stuff, should be fixed once we get her levels corrected in her system. Kelly, we're going to fix you! So I'm glad we got to the bottom of that. I know it was a lot of work and it took some time and some different testing to do, but I think we can get her taken care of.
Good job, doctor.
Thank you. Bye, Kelly. So, to wrap up, in this lesson I showed how the use of storytelling and journaling, both methods of narrative learning, help us work through a difficult case. You do not need to get into the technical details with a client to help them make sense of what's happening to their pet's health. In fact, only using medical terminology and explanations on a technical level will probably do more to contribute to misunderstanding and confusion regarding the health of their pet. With the use of narrative, we can contribute to understanding of their pet's health with less confusion. By helping them understand better, we can help increase the understanding of both our clients and those people that the clients come in contact with on a daily basis. By increasing the knowledge and understanding that people have in regards to animals' health, that will increase animals' welfare altogether.